Assalamu alaikum. Today the topic is horseshoe kidney, which is also another congenital renal anomaly. So horseshoe kidney is basically asymptomatic. It is seen on incidental discoveries on investigations such as X-ray and CT scan. So it is a fusion anomaly. The lower poles of the kidney fuse, and it is seen in 1 by 400 live births, and it is common in males. The isthmus, or the junction of the two kidneys, lies at the level of L4 or L5 vertebrae. It is because the kidneys fail to ascend due to being caught up in the inferior mesenteric artery, because the lower fused poles cannot pass through this artery, as a result of which the kidneys remain at a lower level. The normal level of the kidney is from T12 or T11 to L1 or L2. So there is failure of ascent of the kidneys due to the inferior mesenteric artery, and the kidneys are malrotated. They face medially, and the vascular supply of such kidneys is variable, and the ureter inserts high on the renal pelvis. This anomaly is associated with an increased risk of genital anomalies, increased risk of pelvic ureteric junction obstruction, increased risk of kidney stone formation, and an increased incidence of Wilms tumor, which means that the congenital or primordial kidney tissue still remains inside the kidney. And this common tumor is seen in young male infants, and it is seen with horseshoe kidney disease commonly. Okay, so the fused massive kidney has two collecting systems. We've already discussed the level of these kidneys, which is L3 or L4 vertebra, and the incidence is 1 in 400 to 800 live births. So the collective systems are fused, and two ureters are still present and connected to this kidney mass. They are already malrotated with the pelvis facing anteriorly, and they also have an incomplete ascent lying lower than the normal kidneys due to the inferior mesenteric artery, which prevents their ascent. And the calyces can be seen on IVU as joint hand structures. The calyces are basically fused because the kidneys are fused. And we've already mentioned that it is common in males. The kidneys normally ascend and the testes descend during development, and there is dull kidney pain seen, and it shows that the patient has Rovsing syndrome. So horseshoe kidney disease is associated with Rovsing syndrome, which is seen as abdominal pain, nausea, and vomiting, and it is seen at the hyperextension of the neck. These symptoms, abdominal pain, nausea, vomiting, or Rovsing syndrome, is seen at hyperextension of the neck of the patient. And if this is common in females, it can result in dystortia in pregnancy, especially during labor. It can interfere with labor or the crown presentation of the fetuses. So horseshoe kidney disease can be seen as an incidental finding in females during pregnancy or during labor.